Is the loose skin on your face or a sagging chin making you look tired or feel older even when you're well rested? If you're interested in how to dramatically rejuvenate your appearance to look younger and refreshed, a facelift can take years off your look, but one type of facelift definitely does not fit all. Each face ages differently, whether it involves sagging skin, wrinkles, or both. Here is what you need to know. Before moving forward with a facelift or any cosmetic enhancement, there are some basic guidelines you should keep in mind in order to decide if the procedure is right for you. And as with any major decision, you should weigh the pros and cons, make sure you're well educated and informed, and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one that is actually board certified in plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and one who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. There are several different types of procedures available: traditional, mini, and mid-facelift. The type of facelift you and your doctor choose will depend on the severity of skin laxity and other signs of aging you're looking to address. This video will educate you on the facelift procedure options your doctor might discuss with you. A traditional facelift is ideal for addressing multiple signs of aging, including excess facial skin, deep facial creases, and heavy lines and wrinkles. It's often performed using an SMAS, or submascular aponeurotic system, in which incisions are made near the ears, enabling deeper layers of muscle and tissue to be pulled tighter, while excess skin is removed and wrinkles are smoothed out. If you're looking to address early signs of aging in the mid-face, including the cheeks and nasolabial folds, a mini facelift may be the option for you. This limited incision option, usually placed at the temples and hairline area, allows your surgeon to access underlying tissue and muscle. A mid-facelift is a term used to describe a limited incision facelift that targets the middle portion of the face. This procedure is ideal for those candidates with deep folds around the mouth and mild sagging in the cheeks. It can be performed using endoscopic technology, cameras that allow surgeons to view and reach distant anatomies through very small incision sites. Imagining a younger-looking you is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule should you decide to move forward with the procedure. Don't forget to ask these questions during your consultation, and don't forget to ask about additional fees or payment plans. Gathering all of the necessary information you need will help you make an informed decision. You should come prepared with images you like, but keep in mind these photos should be used as inspiration only. Just because you like something doesn't mean it's right for you. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want and, more importantly, what you don't want. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Once all of your options are discussed and your questions are answered, it's time to book your appointment.